What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host Keoni Tita. Keoni, how are you today?
Doing wonderful. Hi, everybody. Thanks once again for listening to us. This one is going to be kind of a takeoff on the last one we did. It's about stones. This time, it's instead of kidney stones, we're going to talk about gallstones.
All right.
So anybody you know out there who has gallstones or may have gallstones or their diet is headed that way, you'll get a definitely better idea as we talk about it. But any health information about gallstones, let people know about this podcast.
Yeah, you certainly don't want any stones in your body. So whether or
No.
not kidney stones or gallstones, suggest this
Yep.
episode to everyone, your enemies, make sure they don't have any gallstones, all that good stuff.
Yes. But so speaking of gallstones, as the name implies, gallstones are very related to the gallbladder, and gallstones usually are made, at least in part, with bile. And your gallbladder kind of sits right under your liver, and it is kind of the right side upper in your rib cage, and it's the gallbladder sits right under your liver, and your liver secretes bile into that gallbladder. And the reason why it does that is for it to be stored for a meal that you would eat later, because that gallbladder has a duct called the common bile duct that goes empties right into your small intestine. So it aids in digestion, and it aids in digestion specifically of fatty foods for the most part. So it helps emulsify fats. So the bile does that. The other thing it does is, your liver being a detox organ, the liver kind of dumps all its trash into that gallbladder so that it can go into your digestive tract, and then you can excrete it out later. And it kind of speaks to the fact of one way of helping to prevent gallstones, because if things are not working appropriately, sludge will form, and that's actually the name. Sludge will form within the gallbladder, and it will become more and more concentrated, and you get these bile salts combining with cholesterol that will form like these stones. And these stones have bile, cholesterol, and other components like calcium that will form stones, and they can form like little grain-sized stones all the way up to like golf ball sized stones. Gallbladder. And for the most part, many people have these, and it doesn't cause any issue. Some of these are really just found on imaging, like CT scans or x-rays, and they'll say, oh, you have gallstones, and it's no issue. And if they're no issue and they're not too big, for the most part, doctors don't do too much with it. But they can cause problems because those ducts are not big, so those and the gallstones can get stuck in there, and that's an emergency situation if they do.
Yeah.
So that's kind of like a little bit of the anatomy of it. And I think the gallbladder kind of gets a bad rap, though. It's like with conventional medicine, the treatment of choice is like, okay, it's a problem, just rip it out, take it out. And it actually serves a very important function, and it aids in digestion. And without it, it can cause a lot of problems down the road. But the main treatment of choice is just taking it out if you have gallstones that are causing problems.
Yeah, it's so funny that that just tends to be one of the conventional treatments. I'm treating a patient right now who had both his meniscuses removed. Love to run, long-term runner, meniscus were a problem. Let's just take them both out. Like, that's a good idea.
Oh wow,
That's not going to affect the body.
Yeah, I've never heard of that. That's crazy. Well, in med school, I was going to school with a doctor who actually came back to school to be trained as a primary physician. He was a surgeon, but all he did was remove gallbladders all day and every day. That's all he did. So it was pretty fascinating talking to him about it. He just said it got boring, and it's just like standard of treatment.
Yeah. Now, is it safe to assume, Keoni, based off the gallbladder working primarily helping digest fats and things like that, are you at a higher risk if you are having a higher fat diet? Or is it the opposite?
You hit the nail on the head, right? So yes, you are at higher risk with eating the standard American diet, right? So high sugar, high fat, simple sugar diet, low fiber, that all those things will make it increase your risk. The diet is probably the most significant risk factor, but other things play a role. Age plays a role for one thing. Gender is another role. This is pretty fascinating. Women tend to be at higher risk for having cholesterol type gallstones than men, and it's really interesting. I never really understood the mechanism here, why that is, but estrogen actually increases cholesterol secretion into the bile, into the gallbladder and into bile, and then which goes into the gallbladder, and progesterone actually seems to decrease gallbladder motility. If your gallbladder is not contracting, you don't squeeze it out of there. So excessive exposure to female hormones, especially during pregnancy, or estrogen therapy or oral contraceptives, increase the risk of getting gallstones. So gender definitely plays a role. Ethnicity plays a role also. So native people of North South America, as well as Mexican Americans, they also have higher rates of gallstones. But as far as gender go, it's females that get it. Of course, genetics play a role. If you have if there's a family history, then it's going to may affect you. If we're eating a standard American diet, then we're also probably talking about higher rates of obesity. Higher rates of obesity also increase your incidence of gallstones. I've had this happen in my career as a personal trainer a number of times. We would do programs. I remember when we were really young and more dumb than I am now. But what we would do is we'd do these rapid weight loss programs, right? And we'd see how much weight we can get off people in a couple of months, and people love that. They're like, oh yeah, and we would get off a lot, get weight off a lot of people.
Right.
A high percentage of these people would have gallstone attacks, and doing that rapid weight loss increases the risk of gallstone formation too. Yo-yo dieting does the same.
You think that's just you just kind of extracting so much from the system at one time, or what do you think is behind that?
I think one of the things that's probably behind that is lack of use of the gallbladder, right? So think about it.
Oh, that's interesting. Okay.
So yeah, if you're on a very low calorie diet and you're trying to lose weight, you're not eating as much. Your gallbladder is not being worked as much. And so that's probably one of the reasons why. And it's also probably one of the reasons why with any type of weight loss program, if you lose weight in a slow, sustained way, like we're talking about 1 to 2 pounds a week, you don't see this happening. It's usually with rapid weight loss or really low, low calorie diets. And that also speaks to the fact that, nutrition that's delivered intravenously, like total parenteral nutrition, right, where you're not even using the digestive tract. Well, based on what I just said, you would think, well, that should also contribute to gallstone formation, and of course it does. So that type of getting your nutrition there is a big deal. Something to think about. There's also other things, so we brought up obesity, we brought up the standard American diet. There's lots of other diseases and conditions. Most of those other diseases and conditions are related to, chronic disease, like metabolic syndrome, higher risk, diabetes, higher risk, high cholesterol levels, cardiovascular disease, higher risk. It's kind of that whole gamut of diseases that kind of, if you have one, you tend to have the other, that type of thing. Well, gallstones kind of fall into that also. Another thing that you can think, not necessarily related to that, but it does play a role, is any type of liver dysfunction, right? So I know we did a podcast, I think, on NASH, non-alcoholic fatty liver disease, or anyway, that is related to the standard American diet, but also other liver diseases like any type of cirrhosis or anything like that. Anything that can compromise the liver can increase your risk of gallstones. There are also, think about what bile is like. When you think about what bile is made up of, it has bilirubin in there. Anyway, this is where the body gets rid of and helps Yeah, it gets rid of like the old red blood cells. It's kind of like your red blood cells go to the spleen, kind of get shredded, kind of get taken to the liver, get put into the gallbladder to get dumped into the intestines so you can poop them out. Well, bilirubin is kind of that. It takes old red blood cells or useless ones and gets rid of them. So you'll see things like red blood cells that are abnormal, like in sickle cell anemia or beta thalassemia or any type of anemias where the red blood cells are kind of off. You may see an increased risk of gallbladder formation also. So that I find that pretty interesting also, because a lot of people don't think about that with, you're just treating the primary diseases, especially with sickle cell. And you may have like abdominal pain, and some people might just blow it off. It's just part of sickle cell, not necessarily a gallbladder issue. Medications, there are, of course, as with everything, there's medications that can also increase the risk of gallstones. We already mentioned one, right? So we're talking about estrogen. So any type of estrogen or female hormonal therapy is one. There's some drugs that are used to treat acromegaly that can also increase it. There's some antibiotics, thiazide diuretics like hydrochlorothiazide. And I know you've seen this drug a lot, probably in your notes. A lot of people are on that drug. It's mainly used to treat high blood pressure, but that may increase the risk. And then on the other side of the coin, there's also some drugs that may decrease the risk. So one drug that may kind of makes sense, right? Since we think bile is made up of cholesterol, right? To some extent, it's dumping it into the gallbladder. Statin drugs like Lipitor may help decrease the risk. Also, we know that diabetes, you're at very high risk for gallstones. And so diabetes drugs, specifically, they've done studies on metformin, which is one of my favorite drugs out there. Yeah. Those two may decrease their risk. And then me and you both know this, like one of the best ways to cause gallstones is just a sedentary lifestyle. So, that whole motion is lotion thing that you're talking about on the last podcast, I mean, that plays a big role here. And not only does it play a big role, motion is lotion, it actually helps treat gallbladder. So you'll have less attacks if you exercise. Like there's studies on that. You may have gallstones, but if you exercise, minus the extreme weight loss, you will help protect yourself from having a gallbladder attack. And then let's just really talk about what a gallbladder attack does. Have you ever had a patient who had those or described that to you? I mean, yeah. Have you ever had a gallbladder attack?
No.
Oh, okay. Yeah. It's not fun. I mean, even a gallbladder spasm, it's not fun. I mean, you feel like stabbing pain that that's really disconcerting. And if it's a gallstone that's stuck in one of those various ducts that come from the liver or into the common bile duct that go into your intestine, I mean, that's an emergency situation. So that's something that you have to go and get treated. Well, just regular exercise will prevent stone formation, right? But also will prevent gallbladder attacks. And that's really cool to hear, because I would think the opposite in a way. You're exercising, you're jiggling things around, the gallstones get jostled around and get stuck in the duct or whatever. But intuitively, that's not really what's going on. So those are the main risk factors. There's not a whole lot there that is not really common sense, right? I mean, right. But it is something to think about.
And I mean,
and to be aware,
breaks down into exactly, to be aware, because it does break down in two categories of modifiable, non-modifiable, and then being aware of these medications, the diet. And obviously there's not much you can do about your gender and things like that, but right. Let me just talk about this briefly. I know this may get boring for people out there, but I just want to talk about gallstone formation. I mean, bile is like this greenish yellowish fluid. It's produced by the liver. Like I said, it's made up of bile, which is bile salts, and cholesterol, phospholipids like fatty material, electrolytes, bilirubin, that red blood cell breakdown product, and water.
anytime you have excess blood cholesterol levels, you're at increased risk for gallstones, right? And anytime you have a high percentage of cholesterol that's sitting in the gallbladder, it can crystallize and sludge forms, and these crystals will mix with mucus in the gallbladder, and over time these aggregate and form the stones. Now, about 70% of gallstones are what we call cholesterol stones, and they're mostly, as the name implies, they're mostly cholesterol stones. They may not be seen with cholesterol stones because you're not seeing a high percent of like minerals in the stones. They may not be seen on an X-ray. All right. So probably the best way to help determine if you have gallstones is probably with an ultrasound instead of doing an X-ray. Now now I've had a lot of patients over the years where they found stones on X-rays. My mother included was one of them, and they never did anything, to her or anything like that. But just to prevent gallstone attacks, a lot of times, I think she went in for surgery for something else, but anyway, they want to just take it out anyway because they're like, well, you may get an attack at some point, so let's take it out, and that's the standard of treatment, is just kind of removing it. But there are other ways of going about doing that I'll get into.
And removing the stone, that is right.
Yeah, well, and that, you know what, Brian, that's a great question, and I don't know I think you're implying there, can you remove the stones and save the gallbladder? And I am not aware of that, but that is a great thought. If I'm picking up on your brain waves, I mean, that's a great thought, because you would think that you could just like put a slit in the gallbladder, drain it, get the stones out. But that's typically not the case, because I think what's going on there is I think you're just opening up the body to all other kinds of complications, right? Possibly infection, possibly that's what I'm guessing. And I'm also guessing a gallbladder that's filled full of stones is typically a gallbladder that doesn't really function well either, right? So it's one that doesn't contract the way it should. It becomes flabby, like it just doesn't work as well. And so a lot of times it's better just to remove it. And that's what they do. So there's none of this, take a slit and remove the gallstone, save the gallbladder. There's none of that.
Yeah. So
once you remove the gallbladder and the way the ducts are set up, you are still getting some of that bile going into the digestive tract, right? It's slowly dripping in there. It's dripping in there on a constant basis now, because it's not stored in the gallbladder.
Right.
But there is, and so some people, you get the vision, well, is it dripping now just into the lumen of the small intestine, and is there nothing backing it up? Well, there is a sphincter called the sphincter of Oddi, I think, ODDI, which is right there at the small intestine, that opens up with a meal, so you get some of the dripping. So maybe there's some, it doesn't just like drip constantly in there. And that sphincter like relaxes and allows pancreatic enzymes as well as the bile to go in there. But it is constantly dripping there, so you're probably getting some leakage constantly into the lumen, even though you have a sphincter there without, if you don't have the gallbladder.
I wonder how it innately knows. That'd be interesting to, just the body.
Yeah. So there are other stones too. So the most common type is cholesterol stones. There are also what we call mixed stones, that are a kind of mix of cholesterol stones and pigment stones, which are more like the the calcium salts and the bilirubin and the bile, more concentration of that. But 90% of the people in Western societies, they're mostly cholesterol and mixed types of stones. There's other stones that can form, but usually they're due to other rare conditions and stuff like that. It's really common. Like I think the estimate is 40 to 50 million Americans have gallstones, and most of them don't know it.
Yeah, that's primarily asymptomatic, most of them.
Yeah, primarily asymptomatic.
Now, will they, if I have some gallstones right now, am I going to generally pass them, or are they just going to kind of accumulate?
So if you are eating, and that's a great question, if you are eating a healthy diet, typically a healthy diet, higher in fiber, higher in plants, vegetables, that type of thing, and the research has shown that inhibits gallstone development. and actually is part of treatment for small stones, and you are exercising, for the most part, you are removing all the bile in your gallbladder every time you eat. So you're keeping it clean. So you're basically sweeping out your gallbladder every time you eat. Every time your gallbladder contracts, it gets everything out of there and removes all the sludge. In fact, it's not even sludge if it's healthy enough. But if you are eating an unhealthy diet, it becomes sludgy, and now your gallbladder doesn't contract as well, and so it just builds up in there. Now you get stones formed that way. So I would be so compare me and you, right? So you're younger than me. You're pretty good about staying consistent with exercise. I am to some extent. I tend to be more of a weekend warrior with it and just try to move during the week. You would be less likely to have gallstones as compared to me. And I think the main thing between me and you would just be age with that. But if you're exercising and stuff like that, you basically clean it out. So you sweep your gallbladder out if you're living a healthy lifestyle. And it's basically exercise and eating a higher fiber diet. What else? I think so there's a number of things that we have to think about with gallstones. And I don't know which one comes first, like gallstone formation, which causes a gallbladder not to contract as well, or vice versa. I mean, they seem to go hand in hand. It's like, which one comes first, chicken or egg?
Yeah.
But the main complication, the main issue is having a gallbladder attack or biliary blockage based on trapped gallstones in there where it can't function, and your body will let you know something is off, like something is not right, and you will be in a lot of pain. But there are other complications, so let's just go through that. So cholecystitis, that's just the medical term. Choleo is Greek for liver. It's the inflammation of the gallbladder. Choleo is like not liver, for gallbladder, I'm sorry, but anyway, it's inflammation of the gallbladder. And then cholelaiditis is just infection or inflammation in the bile duct or the gallbladder. It can mimic sometimes pancreatitis, which is just inflammation of the pancreas. But the pancreas, you can get pancreatitis from obstruction of the duct, because those ducts, the duct going from the pancreas and the duct going from the liver, both of those kind of intersect and then go into the small intestine. So gallstones can cause pancreatitis also. Another thing that's rare but really dangerous is what's called ileus, and that's where the GI tract can no longer propel stuff down the tract, right? And if a big gallstone gets stuck in the GI tract, you basically put a block up and things back up, and that can be really dangerous and life-threatening also. What other thing? And then they have different names for wherever the gallstones are stuck. Are they in the common bile duct, or are they in the biliary ducts, the left or right one? And based on that, the treatments may be different. So I also said, as far as the way to diagnose is usually, it's usually upper right side quadrant pain, in the epigastric area. You can usually touch there, you get tenderness there. And then to confirm that diagnosis, usually an ultrasound is really all you need to see that.
Yeah, I remember seeing that common bile duct in a cadaver lab. So there's some size to it. Obviously, it's within our body. It's still pretty small, but it is an anatomical structure that you can like really see, and it does have some girth to it as compared to like a blood vessel. Yeah.
It's it's fascinating. Anatomy was fascinating for me also to see all that. Speaking of diet and like GI stuff, you do also seem to be at increased risk for any GI complaint specific. And so like, food sensitivities, any type of food sensitivity or food intolerance can be a trigger. Gluten intolerance, celiac disease seems to be a contributing factor also. So sometimes, I've had patients where they get like these gallbladder attacks or spasms or whatever. And then once we put them on like a gluten-free diet, they tended to go away. So I find that interesting. And when I was doing the research for this podcast, that came up. So I thought that was pretty neat to see. What other symptoms? Oh, well, this makes sense too, right? So, you can get nausea, you get fever, you get that intense pain. Jaundice when it's really gone on long. Depending on if the gallstone is giving you pancreatitis, you may get peritonitis, which can be life-threatening. And that's where, it's starting to inflame the peritoneum around those organs based on, having the gallstone get stuck there. As I said, most gallstones are silent. So, a lot of times you don't have to do any treatment. When I have a confirmed case of gallstones, like one of the things I like to know is like how big they are. And then if we know possibly what type they are, I'm not sure how you could really tell except with imaging. Like if you did an x-ray and you see it all light up, then you're probably thinking, well, these are, really packed full of minerals and things like that. But most are kind of cholesterol stones. So there are some things, including herbals and natural things that can help over time dissolve them so that you can, get rid of them, make them smaller. And that's really cool to see happen, or at least when patients were having all these fits of gallbladder attacks, and then they no longer do when you put them on these herbs, or they haven't in a long time. And I'll name one Chinese herb that I do specifically that I'm sure a lot of people don't know about that can really help. Laboratory tests, we're talking about the gallbladder being attached to the liver. So when it gets bad, right, you may see elevated liver enzymes on a blood test. If you're getting like any type of inflammation on a complete blood count, you may see white blood cells elevated also. These are certainly not diagnostic. Since bilirubin is a component of bile, you may see on a blood test elevated bilirubin levels if there's an obstruction there. And then, to distinguish whether it's pancreatitis or gallstone affecting the pancreas or more affecting the liver, you may see if it's pancreatitis, like elevated enzymes of the amylase and lipase. So let's see what else. Who is that? Your good friend.
We got Luna joining us for the episode.
All right.
Her gallbladder's working well.
All right. Well, that's good.
She's moving around, as you can see.
Check out my gallbladder.
Yeah, that's exactly what she's showing me. The tail end of that.
Yeah. So anyway, the surgery is like really in and out, right? It's like you go in there, you're out the same day for the most part. It's laparoscopic. It's usually a couple of incisions in the abdomen, and they do it real easily and pull the gallbladder out. So it's the medical name is laparoscopic cholecystectomy, right? So you just basically pulling out the gallbladder. That's the main form of treatment, but there is another thing called what is it called? Oh, Actigol. It's a med, or urosodiol. It's a naturally occurring bile salt that can help dissolve gallstones. And so I've had a number of patients do this, and it does work. It's just, it seems when you stop, if you don't get the lifestyle stuff in order, they come back.
Right. Yeah.
Right. And you have to be consistent with taking it.
Yeah.
And one of the things that I always find with this, that when I have my patients have their gallbladder removed, I usually put them on a complete digestive enzyme. I think we've done a couple podcasts where we talked about digestive enzymes. But a complete digestive enzyme is one that has the amylases, the proteases, and the lipases to digest carbohydrates, fats, proteins. But you also want the bile salts in there. And a lot of times people, after they have their gallbladder removed, will have GI complaints, right? A lot of times they'll have diarrhea. Now, typically for most of these people, it's one of these things that is just transitory. Like, it's like only a few months after it and they're fine. But if you're not getting a good secretion of bile salts in there and not digesting your food completely, you can imagine what may happen, right? So if we're emulsifying fats so that fats can be absorbed, what if we're not doing that well enough? Well, if you're not doing that well enough, you're going to tend to have diarrhea, because if you're not emulsifying things, fat will go right through you. That's one thing. Also, fat carries and helps you absorb fat soluble vitamins like vitamin A, D, E, and K.
Mhm.
And so over time, you may get a slight deficiency in that too. And so what I always do is, if somebody has their gallbladder removed, I just will recommend a complete digestive enzyme for them that has the bile salts in there form, that just aids and helps them digest better. And I've heard doctors say typically anybody over like 35 or 40 should be on a digestive enzyme for the most part anyway.
Interesting.
But for when you have your gallbladder removed, I think it's a good idea to do that. It certainly can keep some of the complications down, right? So that's one drug that you could certainly try to use besides getting your gallbladder removed. But I can certainly tell you, like, if you have a gallbladder attack, you have a stone stuck in the duct, you're going to get it removed, and you're going to want it removed. It's that painful. But if they find it inadvertently on imaging, you could certainly try to treat it and get rid of them. Not only with lifestyle, but you can use this ursodeoxycholic acid, or it's called urosodiol. But the other thing that you also can do is they found that metformin, which I talked about, if you take that's the anti-diabetic drug, may also lower your risk of gallstones. And it may improve gallbladder motility too, which is good, which will help aid getting rid of the gallstones. And then statins, right, which can help reduce cholesterol. So if you're helping reduce cholesterol, you may stop storing a lot of cholesterol and bile into the gallbladder, and therefore your body can catch up and get rid of what's there and help get rid of stones. So those are some meds that may work. And there's another drug called Zetia, which also is like a cholesterol lowering drug, and it will not only, it doesn't treat gallstones directly, but it inhibits absorption of cholesterol in the intestine, and then it also inhibits your body making cholesterol in the liver. So anyway, that drug may help, but again, these are not like the standard approaches to treatment. But I bring them up because people, hopefully when they hear this podcast, they know they have gallstones, that you should try to get rid of them. All right, so that brings me to another point, because people go, all right, when's he going to talk about the gallbladder flush? All right, well, I'm going to talk about it right now, because have you heard of this gallbladder flush?
I have not.
All right, well, the gallbladder flush, it's usually touted by self-proclaimed internet gurus online.
Yeah, and I don't flat tummy tea thing.
yeah. And again, I don't want to sound negative about it, but there's some problems there. First of all, it's touted like it works, and there's never been a good study that shows that it does work. But let me just tell you how it's done first. Typically, to do this, and it's considered an old naturopathic cure.
Okay.
You will fast for like 18 to 24 hours. And then after that fast, you drink like 1.5 to 2 cups of pure extra virgin olive oil, followed by a couple shots of lemon juice.
I have heard of this. Okay. Right. I know the recipe, not the name.
Yeah. So what you're doing is you get a big dose of fat, right?
Yeah.
Lemon. And this can help cause the gallbladder to contract. And one of the studies that I read that did this, they didn't find any stones in there. Now, there's been a lot of anecdotal stuff that says that you can find stones, and you should find stones, because it will cause the gallbladder to contract. Like you definitely should find some sludge and stuff like that. So that could be like a gallbladder cleanse. The issue is if you do have big gallbladders and you're really forcing the contraction of the gallbladder, you may. Again, this is theoretical too, because I've never run across a patient where this actually happened, but in theory, it could. If you're like really squeezing that gallbladder with your lemon juice and olive oil, you may push one of those bigger stones into the duct and get blocked there. So you may be creating an emergency situation.
Mhm.
That's one of the reasons why I don't tout doing that. Unless you've looked, you've had imaging of your gallbladder, had an ultrasound, and it doesn't seem like there's going to be any problems for you doing that. I'm just not so sure that you're doing a lot of good with that. One of the things I would recommend doing is trying some of these herbals or drugs that help dissolve the gallstones, and try to dissolve as much as you can before you even do that, and making
Yeah,
sure you don't have
makes
big stones. But I've had over the years, I have a number of patients who come into my clinic who, rant and rave about these gallbladder flushes, and they do
And
it
they're wearing a
probably good.
diaper.
Yeah, well,
I can
a
imagine.
lot of times, yeah, especially with all the fat you're drinking, right? Yeah, exactly. I mean, it really gets your bowels going. So certainly in that way, it is a type of cleanse. That's for sure. I don't recommend that unless I have all the information that the person is going to be safe doing it. I mean,
Yeah, it makes sense.
worst thing that's going to happen is you'll be running to the bathroom. But anyway, what's the best way to prevent it is exercise, diet. High fat diet, high sugar diet, high calorie diet, that increases your risk. On the other hand, a diet that's high in fiber, fruits, vegetables, plant proteins. I do say plant proteins because there were studies where animal protein increase your risk, whereas plant proteins do not. Nuts, seeds, all that type of thing, legumes, olive oil, all that stuff seems to be with reduced risk of having your gallbladder removed. So that's something to make sure that you're doing. Judicious weight loss, we talked about that. Make sure you're doing it carefully. Make sure you don't get somebody who, like at the time when I was 24, 25, wasn't in med school yet, and just putting these people on these crushing like weight loss regimens and not knowing what the hell I was doing. And people could go into a gallbladder attack because of that, with rapid weight loss. Specific foods. Now, we talked about this on one of our constipation podcasts, right? One of the things we talked about, lemon and olive oil, like getting the gallbladder contract. Well, we also talked about bitters and could help with like moving things along in the digestive tract. Well, what's really interesting, the bitter foods like coffee, or I should say bitter drinks, but like coffee and tea, that appears to reduce the risk of gallstones. So I think there's a study where there's a high intake of green tea. Again, you want to do plain green tea. You don't want to do it full of sugar and everything else. But the bitterness of that seems to have some type of effect. And it may even be some of the compounds in there that have an effect that can decrease your risk of gallstone formation. So coffee and tea.
What about my cocktail bitters, Keoni?
So your cocktail bitters, anything that tastes bitter. So it's a good point. Anything that tastes bitter will do it. Some cocktail bitters are just bitter herbs. If I'm thinking right, but if anything that tastes bitter can do it. And also a lot of those bitters, like tincture bitters, are made from like spices and herbs. And what we also find in the studies is like dietary spices seem to reduce the risk of gallstone formation. So we're talking about turmeric, cayenne, black pepper is one that I found fascinating. Turmeric and black pepper kind of go together. Both of those seem to prevent them. Garlic, onions, we consider these liver foods, like in naturopathic medicine. Garlic and onions, things with sulfur, the smelly foods, fenugreek, bitter greens, all these things will reduce your risk of that. So let's talk about some nutrients that come up in the research that seem to help prevent and possibly treat gallstone formation. One of them is vitamin C. All right. And I find that pretty interesting. I mean, vitamin C is well known. It's a water-soluble vitamin. It's known for neutralizing free radicals, decreasing oxidative stress. You get a lot of oxidative stress when you have a stone stuck in your bile duct. So that's one way it may help. But what they're actually finding in the research is people who take, anywhere between, I think they did like 250 or 500 milligrams of vitamin C a day for 2 weeks or 4 weeks, they were less likely to need surgery if they were scheduled for gallbladder surgery, which I find very interesting. So there's something to be said for taking vitamin C every day. Some people do, well, I've heard docs say, oh, it's a waste of money to take 500 milligrams of vitamin C a day. Well, it doesn't seem to be that way as far as preventing gallstones. And that's pretty interesting that is happening, and that they've done studies on that. So the correlation between, vitamin C levels and gallstone risk is pretty neat. It does appear to be stronger again in women, but women are the ones who tend to get gallstones too.
Right.
Or tend to have the problems with
And it's
them.
interesting because that's not a fat soluble vitamin, right?
That's not a fat soluble vitamin. Yeah. That's a real easy one to do to increase or to help prevent. Now, that is not something I'd say, oh, I have gallstones, let's treat it with vitamin C, but it is a way to help prevent. There's also a neat study, double-blind placebo-controlled study on fish oil, omega-3 fatty acids.
That one makes natural sense.
Yeah, and they combine that with the urideoxycholic acid that helps dissolve stones, and basically what they found was that it decreased the risk of gallstone formation, and also decreased the risk of having to have surgery for gallstones. SAMe, S-adenosylmethionine. This SAMe definitely is protective for the liver. A lot of liver diseases. Anybody with any type of liver issue. Again, on our podcast, we say 40-50 million people have gallstones. At least that many probably have NASH in the United States, and that's a liver issue. SAMe is a good thing to take for that. It seems to reduce your risk. And also it seems to reduce your risk for women if you're on contraceptives, right? Because contraceptives increase, hormones. The hormones seem to increase cholesterol production. It seems to increase your risk of gallstones. Now, here is my favorite spice, is curcumin or turmeric. And the main active constituent is curcumin. And there's lots of animal studies that show that it seems to enhance gallbladder motility, right? So this is one where you may be able to treat small stones with just curcumin by itself. If you're enhancing gallbladder motility, you're helping with contraction. Curcumin is a great anti-inflammatory. So if you had your gallbladder removed, you can reduce the inflammation by taking curcumin. So it's a good thing to take after gallbladder. But also, any type of gallbladder inflammation before surgery or whatever is great to take curcumin. And also, curcumin aids in bile acid metabolism, so that also can be great. And at least in animal studies, it seemed to protect in the development, inhibit the development of gallstones with mice. And we just said black pepper is a spice that really helps, and curcumin and black pepper go really well and potentiate each other. Both of those potentiate each other, especially with preventing gallstones. So that's one that you can use if you're getting gallbladder attacks or getting inflammation there before or after surgery. Curcumin is a good one. What else here? There's some studies on iron that may help. I don't recommend, if you're anemic, and you need iron, that can certainly help reduce your risk of gallbladder issues. If you're not anemic, I don't recommend that, especially for men. We talked about green tea, but there are studies specifically on EGCG, epigallocatechin gallate. It's also has demonstrated gallstone prevention. Again, this is an animal study, mouse models. And I know people are probably like, well, what about milk thistle? Milk thistle is another one, and that's a liver herb. And it does seem to, just reduce the content of bile in the gallbladder. It does seem to have some anti-cholesterol producing effects. It does seem to have a balance. It balances out the negative effects that estrogen may have on bile flow, at least in animal studies. Milk thistle traditionally is known as a liver herb. It's a very safe herb to take. So I will recommend that to people who are having like gallbladder issues.
Mhm.
Let's see.
What about these Chinese herbs, Keoni? We haven't gotten to those yet.
Right. So it's interesting. There are a number of herbs that certainly can help with various aspects. And if they fit the Chinese patterns of gallbladder issues, that can certainly help with stones. But I usually use herbs that are kind of used in the Western sense where, okay, we got gallstones, we need to get rid of them. They're not too big. Can we help break them up or dissolve them? So there is what is it called? Well, there's a Chinese herb called Li Dan, which is basically called breaking gallbladder stone formula. So this is a
That sounds
formula.
good.
Yeah, this is a formula.
That sounds like what you want.
Yeah, it's a formula that I have used before. And then I do use, I won't name the company, but as soon as I name the name, people who are familiar with the company will know, but it's Lai Machia gallbladder formula. Anyway, it's a Chinese herbal company that has this formula. The Chinese herbal formula, here we go. I'm going to, completely slaughter the Chinese language, so I apologize. But Shao Chai Hu Jia Jin Kian Kao Pian. That is the gallbladder formula that I tend to use in my clinic. And guess what herb tends to be in there in a high percentage? It's curcumin, or the root of curcumin. There's a lot of other herbs in there. But I use it specifically for gallstones. I use it for gallbladder spasms, any type of inflammation in gallbladder. It's kind of like a good all-around formula that helps with any type of gallbladder issue.
Safe to say you've seen success with all these, Keoni?
I've seen some success with all of those, but you just have to be, and it's hard to define what success is, right? I mean, because I define success, and this is all anecdotal, that, okay, I know somebody who has gallstones, they've had a gallbladder attack, I put them on this stuff, and they haven't had a gallbladder attack.
Okay.
Or they haven't had it at the frequency they normally had it before. Right.
Any of them where they had the imaging or the ultrasound done and you can
I've had one patient where they had the imaging done and they didn't see the gallstones there.
Cool.
Now, I don't just give
right.
I don't just give the herbs because I'm like, okay, it's a lifestyle thing. Yeah.
Right.
It's a lifestyle thing because I still, like me and you both, it's like, okay, well, yeah, you have gallstones, but I can tell you the best way to cure them is to prevent them from forming in the first place, right? And that's diet and lifestyle. So you need to do that in conjunction with this other stuff. When I put people, like if somebody wants to do a gallbladder flush or wants to be on these herbs, I just tell people, one of the caveats to this whole thing is if I give you this, there is, in theory at least, and I've never seen this, but in theory, we may exacerbate the condition, right? Because we cause the gallbladder to contract. We put a gallstone in the biliary duct, and guess where you need to go? You need to go to the emergency room, and guess where they're going to send you as soon as you get there? Up to surgery to get the gallbladder taken out of. So it's those caveats. You just have to be upfront about what you're doing, and be careful about kind of what you're doing, know what you're doing.
Right.
So, but there's a number of Chinese herbs, getting back to that you certainly could use based on various gallbladder issues. There are actually some homeopathics too that you certainly could use. I haven't seen any results with homeopathic remedies and gallbladder issues. I think one is called chelidonian or something like that. I know some people who really swear by homeopathy and have said that they've helped with that. I don't understand it. I kind of put more of my weight in the nutraceuticals and the lifestyle and the Chinese herbs. And that's where my experience is mostly anyway.
Mm-hmm.
So
seems to be what the research backs as well.
Yeah. So anyway, I think that's it. I wanted to go over that with people because there are things that you can do, whether you have to go in for surgery or not. There are some natural things that you can do just real quick. If you have your gallbladder removed, it's probably a good idea to get on a digestive enzyme afterwards, just to help you digest. Another thing is make sure that you're really good about getting your fat soluble vitamins in. It speaks to getting a multivitamin in. You may be at risk for having deficiencies there. Get your vitamin D level checked. Low vitamin D level, and somebody has their gallbladder removed, in theory, at least it may cause you to have low vitamin D levels. At least you're not getting a lot through your food, and if you're taking a supplement, you may not absorb well.
Right.
So there's stuff to think about. If you're at risk, and you're at risk if you're pre-diabetic or overweight, have liver issues, you're at risk. Like, really, you want to take care of your liver. And if you do that with some of the lifestyle stuff we talked about, you're going to significantly decrease your risk. Most stuff we talked about, you just can't go wrong with. Like, I just don't think you're going to cause a problem if you have gallstones by doing some of the natural treatments like vitamin C or omega-3 fatty acids, drinking green tea. I've never seen somebody drink green tea, or heard of somebody anecdotally drink green tea and then have a gallbladder issue. I have seen people get gallbladder attacks, like I was saying before, with extreme weight loss, rapid weight loss. So that speaks to, again, maybe I talked about it, but fasting, like intermittent fasting, that's a risk to intermittent fasting. I think we talked about that in our intermittent fasting thing.
Yeah.
Not that you're getting extreme weight loss with that, but you're not eating as much, and the longer you do a fast, the more at risk you may be for a gallbladder attack.
Yeah.
So, anyway, I think that's it. Everybody out there, if you have any questions, just shoot us, talk to us on social media. Shoot us some questions or whatever else you'd like to hear.
Well, we'd be remiss, Keoni, if we didn't mention your wife on episode 22, bile health and gallbladder dysfunction.
Oh, that's right.
And that was March 7th, 2018. So almost 200
No
episodes
wonder,
ago.
yeah, no wonder.
4 years ago.
Yeah, no, I'm glad you brought that up. Thank you for bringing that up, because I was thinking, I can't believe we haven't talked about this before. And she did talk about this a little bit then. I remember that.
Yeah, she's got her gallbladder liver school. I don't know if that's still open for enrollment or not, but you can find that in that episode.
I think it is. I think it is still there. I think you can go to her website, jilliantita.com. I think it's there. But
either way, you can go to episode 22 and we've linked to it there.
Okay.
You can check it out there.
Yeah.
And yeah, episode 22. And then just speaking of social media, we have been more active on all the social medias. Again, we're the Wellman's Podcast, and you can find us on YouTube. You can find us on Instagram at the Wellman's Podcast. And if you want to get in contact with us and suggest episodes, questions, things like that, that'd be a great way to do so. And we would love to have like a segment where we have a little bit more questions from like a previous episode.
Right.
We've definitely talked about that. And
or points we miss, right? Like just things
certainly.
like things that should be said,
Yeah.
It's called the practice of medicine for a reason. And so, yes, it's a learning process for us also.
Yeah. Terrific.
Yeah.
All right. That's it. That's it for me, Keoni. Anything else?
No, that's it. Thanks for tuning in, guys.
Yeah. Tell a friend, tell an enemy, tell the president, shout it from the rooftops, the Wellman's Podcast. And if you have anything you want to suggest we talk about, we are more than happy to do so. And until next week, be well.
Take care.